You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Brad White, and we're glad you joined us. Before we begin, we'd like to thank our sponsors, Studio Arts and Glass, Cleveland Clinic Mercy Hospital, and of course, our socially distant technical producer, JD DeAngelis. Today, Paul and I are broadcasting from our administrative offices, and our guest is Ben Benedetti, registered polysomnographic technologist. Is that right?
Yeah, it's a tough word, but polysomnographic.
Polysomnographic.
Yeah.
And clinical manager of the Sleep Center at Cleveland Clinic Mercy Hospital. Good morning, Ben, and welcome to the show. Sleep plays a critical role in health. Nothing makes me feel worse at the beginning of a day than not getting a good night's sleep. And a good night's sleep empowers the whole body to recover and lets you wake up refreshed and ready to take on the day. Unfortunately, many people have sleep problems and don't get the rest they need. Insufficient sleep and poor quality sleep can be due to diverse factors, including sleep disorders, medical conditions, and mental health. Sleep issues affect people of all ages and its impacts, and they can be very far-reaching. We'd like to remind our listeners today that you can get our weekly Health Matters programs on our podcast, which you can download from the App Store on your favorite smartphone app. Just look for Health Matters with the Medicine Center Pharmacy, and you can listen into any of our programs anytime. So
how's my voice coming through or not?
I got you now. Go ahead. Thank you.
Okay.
All right.
Okay, Ben, welcome again to the show. And please tell us a little bit about yourself. Introduce yourself to our listeners, please.
Good morning, Paul and Brad. Thank you again for having me on here. So I'm Ben Benedetti, as you said. I am the clinical manager at Cleveland Clinic Mercy Hospital. I've been there for about 6 months. I'm originally born and raised, and I actually still reside in Ashland, Ohio.
Okay.
My history involves fire and EMS to start. Did that for about 5 or 6 years and kind of got into the world of sleep medicine just because of its importance. I think I kind of saw it in my personal life affecting many people around me. So that's where I am now. I'm at I made the switch to sleep medicine, and I'm currently at Cleveland Clinic Mercy.
Now, are you in the accessory building there in the back, or are you in the hospital actually?
It's actually in the medical office building on the 4th floor.
Okay, gotcha.
Yeah.
So I understand that sleep apnea affects roughly 22 million Americans with an estimate of 80 cases being undiagnosed and untreated. Can you explain our listeners what sleep apnea is?
Yeah, absolutely. So sleep apnea, in its simplest form is our airway muscles and soft airway relaxing so much as we fall into sleep that it actually occludes on itself. I tell a lot of my patients, if they can imagine a fire hose with no water going through it, it falls on itself and it collapses. When that happens, it typically, we're not bringing any fresh oxygen into our body, so our oxygen levels start to go down and our CO2 levels start to rise. When that happens, your brain says, hey, you need to wake up and fix this level. So that's where we get this arousal, and it wakes us very gently. And that causes the deprivation and causes the patients to typically feel unrested because this is happening many times per hour. There are 3 different types of sleep apnea. There's obstructive, which is exactly what we're talking about here. There's also central sleep apnea, which comes from the brain and its ability to communicate with the muscles and tell our bodies when we need to breathe. And then there's complex sleep apnea, which is it's rare, but it's a mixture of both obstructive and central. Obstructive is the most common that we see in the clinic. and it affects the most people. So that's kind of the basics of it.
So what happens if we don't treat it?
Well, maybe as you've seen, even as of recent, that sleep apnea is affected to, it's linked to just about every serious condition, such as chronic heart failure, atrial fibrillation, which is a big factor with people. Diabetes can lead to stroke. Certainly, some of the accidents that we've seen, industrial accidents, car accidents, the deprivation plays a giant role in how we function during the day. So it can all be linked to that.
So what about the most common symptoms? How do we diagnose this?
It's funny, when we're in their clinic, I typically listen to the wives. They're always the ones that will tell us the most. I always get my husband snores so loud, he's pulling the paint off the walls.
Okay.
Falling asleep at the desk, he's kicking, making noises. So snoring is definitely the number one that I hear. Now, does that mean because I snore I have sleep apnea? No, not necessarily. But it is a good indicator that something is obstructing, right? Because that's what a snore is. It's the tongue falling back into the soft airway and creating a vibration. So that's a partial obstruction. Next would probably be gasping. If you hear somebody gasping, that's certainly an indicator that there's a blockage going on in the airway. If anybody ever, remembers being on the camping trips as a kid and hearing, somebody in the tent 3 tents away, pulling the walls of the tent in, that's a big one. Morning headache is another one that is a red flag to me if I hear that from a patient. I wake up with these morning headaches, they're unexplained. I typically don't have them during the day, but in the morning time, they're present. That might alert me to think about sleep apnea. Another big one is, this feeling of excessive sleepiness at 10 a.m., 11 a.m. So let's take a normal sleep patient that goes to bed at a reasonable time, 10:30, 11 o'clock, they wake up at 6, 7. They shouldn't be tired at 10 a.m. They shouldn't be exhausted or be able to, lay down and take a nap. That would be excessive to me. Might raise a marker for sleep apnea. Irritability, as you said before, when you, Paul, when you said, when you don't get that good night's sleep, it. You generally are irritable, and you don't maybe want to be around everybody, and you're just dragging throughout the day. So this is how it really affects folks. And this is kind of what we look for as general markers, when we start to paint the picture of what a patient might actually have going on.
So are some of your symptoms you just mentioned there, are they involved in diagnosis, or is there a separate process for diagnosis?
Yeah, I think that they are part of the diagnosis, in that we start to build the picture of the patient as they come into our clinic. We kind of get an understanding of what they're going through. So if they come to see a doctor, our doctor, and they're telling him these symptoms, he might order what's called a polysomnogram, or as you might hear, a PSG. And a polysomnogram is a comprehensive exam that we do in the sleep clinic, typically at night, where we would have a patient come in and be monitored with different electrodes during their sleep to watch for sleep apnea. And that's typically how we would diagnose it. And then, after the test, we would look at the results, and we would compare how the patient is feeling and the symptoms that they expressed when they were in the clinic. And then based on what we see, during the PSG would kind of dictate the route we went with them.
Okay. So how has the coronavirus pandemic challenged the sleep center and your day-to-day operations?
It's certainly shaped the way we handle patient care and practices in the sleep lab from almost every aspect, from creating and establishing brand new policies, or fine tuning and tweaking policies that we already had in place. We have gone, in my opinion, above and beyond, the standard, and that is by just continuously reevaluating what we've done and what we've put into place. So initially, when this happened, we started a routine vetting process where we were calling the patient multiple times while they were scheduled to check up on them and see how they were doing, see if there were any changes, if there were any symptoms, what their day-to-day life is like. We actually added a negative pressure room at our Jackson location, which is just an isolation technique. And basically, in simple terms, it prevents cross-contamination by not allowing air from that certain room to leave. Air can come into the room, but it can't leave. And that's important when we use Cpap therapy, because patients are, atomizing their exhalation. So we did do that. We also added a robotic UV light sterilization process, which is very, very neat. We just used that this week, actually, on our home sleep testing devices. And what that looks like is at Cleveland Clinic Mercy Hospital, we are able to take our devices to this robot that uses extreme UV light for sterilization. And the robot can actually be used in the patient rooms and are used in the patient rooms. And it's a sterilization technique that is pretty neat. It's unlike anything else. We also set up telehealth, which is huge right now for folks that are still, a little nervous to leave. We offer the ability to sit at home just like this and communicate with a doctor. And that's an important piece to have, just to keep up that continual effective communication with the patients.
Does it make noise? Is it noisy or is it silent?
The UV sterilization robot?
Yeah, right.
It's not silent. There is a little bit of noise, but it's not anything loud. We were standing, probably 10 to 15 feet away from it. It's in a giant tent. Okay. And it's neat to see.
Hey, I think we better take a break here, Ben.
Sure,
okay.
absolutely.
All right, it's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries, or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic, Mercy Hospital, telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
St. Patrick's Day is just around the corner on Wednesday, March 17th, and you have to wear the green. The Half Off and Out By store in Louisville has built a huge green display: hats, wigs, necklaces, jewelry, beads, and much, much more. I know you're itching to celebrate just about anything since you've been constrained for so long. See us on Facebook at Half Off Hot Buy and also on our website at Half Off Hot Buy. So hurry over to the Half Off and Hot Buy store in Louisville. Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play: our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing sleep studies with Ben Benedetti from Cleveland Clinic Mercy Hospital Sleep Center. Okay.
All right. So how about is sleep apnea testing done in a sleep lab, or can it also be done in our home?
That's a good question, Brad. We've actually moved to doing home sleep testing as well as in-lab testing. We do offer both at Cleveland Clinic Mercy Hospital. Both tests are able to diagnose obstructive sleep apnea, and it's, with the creation of home sleep testing, we've been able to reach a population that maybe we couldn't before. We've actually ramped up our home sleep test program during the COVID crisis, in that we added 6 new units. So we have 20 home sleep testing units right now that we're currently putting out, every week. Every day we do a few based on patient need. But that allowed us to actually open up, as I mentioned before, to people that were maybe afraid to come into a hospital facility or, a clinic, which we totally understood. So we kind of thought outside the box of how we can still remain testing and accommodate the patients. So what we've done is we've developed a system where the patient gets scheduled for a home sleep test. They're able to drive into the Cleveland Clinic Mercy Circle, call us from their car, and we have one of our registered technologists come down in PPE and actually instruct them how to do the home sleep test. They give them the device, the patient takes it home, wears it. They bring it back the next morning. They call us from the circle again. We come down, pick it up, and we have results. So it's just become very efficient for those people.
What determines if you do it at home or you do it in the hospital?
Yeah, that's a good question. I think that the doctor is first and foremost. The insurance companies certainly play a role in it. There are certain criteria that need to be met for home sleep testing. I don't certainly want to make it sound like it's less of a test, but there are certainly fewer parameters that we're watching in a home sleep test. And I wish I would have one now for you to see, but it's just a device that sits middle chest with a belt and a pulse ox and a cannula. So we're looking at flow, airflow, oxygen saturation in the blood, and respiratory effort. People with cardiovascular disease or COPD, they probably wouldn't get a home sleep test. We do see people that have cognitive inability, we would want to take care of them in the hospital if they suffer from anything like that. Also, people under 18 years of age, we really need to have them in the hospital as well. We wouldn't want to do that on any pediatrics. So the medical history, the insurance companies, and I say insurance companies because sometimes they like to use that as a screening tool before they commit to doing an in-lab test. But I think you could see kind of when I said earlier about reaching a group that maybe we couldn't get, with the ability to stay and sleep in their own bed, it's certainly become appealing to people that, are tired.
So they wear this device for 24 hours?
No, typically they'll wear it for 6 to 8 hours a night. Depending on the patient's sleep schedule is when we would schedule this test. So if you can imagine, say you would go to bed at 10 o'clock and get up at 6, we would have you come into the lab around 7:30 just to go over the device, make sure you understand it, show you how it works, show you how it's hooked up, answer any questions that you have. And then you would take that home. And as you start to feel drowsy in your own home, that's when we tell you to put it on. Go ahead and put it on and start it, get it rolling, and then, go to sleep with it. And when you wake up in the morning, you'll simply turn it off and take it off and bring it back.
So you're not looking for a full, let's say 7 or 8 hours of sleep time, is it?
Yeah, that's pretty correct. I mean, it's just like every other test. And I answer this question quite a lot. We don't need 6 to 8 hours of sleep to diagnose sleep apnea. Typically, those apneas that we were talking about, they're broken down into events per hour. So as long as we have 6 hours of recorded time, meaning from the time you turn it on until you turn it off, as long as we have 6 hours of recorded time, we'll typically have an hour of sleep in there. And we can get a good understanding of what happens in 1 hour of sleep based on, your symptoms again.
Okay, Ben, bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White.
WHBC AM 10, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, the Ohio Department of Health updated its COVID-19 travel advisory list to include 5 states where Ohioans are advised against traveling because of positive test rates that are at 15% or higher: Idaho, South Dakota, Iowa, Alabama, and Kansas. Health officials have now administered about 83 million doses of COVID-19 vaccine across the United States. That figure, reported by the CDC, accounts for about 75% of the 109 million doses that have been delivered to the states. Ohio schools still would have to administer nearly all the usual tests this spring, but would have an extra week to conduct most of those in person under the legislation that was passed yesterday. Lawmakers initially wanted to seek a waiver to skip those required tests for a second straight year, but federal officials indicated that is not an option. March Madness fans are being given a new way to cheer on their favorite basketball teams. Since capacity is restricted to 25%, the NCAA has decided to fill empty seats with cardboard cutouts. They'll be at this year's Final Four and championship game. And for $100, anyone can upload their picture on one. But instead of tossing the cutouts after the game, fans get it sent to their home for another $35. Tonight on 1480 WHBC, it's girls high school basketball tournament action, a regional final. Glen Oak takes on Akron-Hoban. Tip-off is at 7:30. Our John Bazika and Bob Jeffries will have the call. More news coming up at 10 o'clock. I'm Pam Cook.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries, or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your medicine center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
Your severe weather station, News Talk 1480 WHBC.
Plenty of sun this afternoon, a high 37. Clear for tonight, low 25. Sunny, chilly Saturday, the high 33. Sunday, partly sunny, high 36. Monday, sunshine and clouds to start, and mostly cloudy by the afternoon, high 55. Tuesday, clouds and sun with a high 62. And for Wednesday, sunshine and clouds, mild with a high 61. I'm Andy Ross for News Talk 1480 WHBC.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Okay, we are back. You're listening to Health Matters at the Medicine Center Pharmacy. I am the host and pharmacist, Paul White. We're talking about healthy sleep habits. We have a lot more to cover this morning. We're talking with Ben Benedetti from Cleveland Clinic Mercy Medical Center. Boy, I'm taking a while to patch that one together. You have one more question, Brad?
Yeah, Ben, tell us and tell our listeners, you mentioned bringing people into the hospital to do a sleep study. What locations can people get a sleep study done at Cleveland Clinic Mercy Hospital?
Yeah, sure, Brad. We have, so we do offer a 10-bed accredited facility. We have 4 beds at our Jackson Stat Care office, which is on the 2nd floor. And we offer 6 beds at the medical office building at Canton Mercy Hospital. Both are set up much like hotel rooms, in that they have private restrooms within each room, and they have TVs, and they look a lot like hotel rooms. Mm-hmm.
Is most of this covered by insurance, or a portion of it, or?
Yeah, absolutely. Most of it is, and most insurance companies have kind of come on board to understand that sleep is extremely important to our health. So we typically see, most insurance companies covering it. We do offer no insurance options as far as payment goes, and just a wide array of availability for all insurance companies, Medicare, Medicaid, but it is becoming much more broad and accepted, especially with the ability to do home sleep testing.
Interesting. So walk us through a testing process. And tell us how we do it, I guess.
Absolutely. So once you have, it's been decided that you need a sleep test, you'd come to one of our locations. You'll be greeted by one of our nice technologists at night. We have a great staff. They're very friendly, and they're just top notch. What they'll do is they'll show you to your room. They'll explain the procedure. They'll give you some paperwork to fill out, a couple questionnaires based on their sleep. And all that is pretty much objective information that we use in the diagnosing. Then they'll hook up and clean areas on your body where we will put electrodes to monitor your sleep. We monitor sleep through brainwave activity. We monitor pulse ox, EKG, so we're looking at your heart, leg movements, respiratory effort, so we can determine what kind of apnea it is. We talked about obstructive and central, and your airflow. So we try to accommodate patients based on their need. And so if we have someone that works a shift job, we will open our lab on the day. We'll bring them in during their normal sleep time. We have daytime technologists that fill those roles for us as well. So we want to be well-rounded and be able to accommodate a wide range of people. We understand that everybody works and everybody's on a different sleep schedule. So during the day, it's like the same procedure at night. So then we would put you in bed and then monitor you from a computer, just outside the room remotely. You're hooked up. You kind of feel, like you're kind of confined to an area, but really a lot of the wiring is redundant. So in case you do toss and turn, not to worry. I just tell the patients to get comfortable and sleep as they normally would. You're also video monitored, so we can, watch any type of sleepwalking, any sleep talking, and we can associate what we're seeing on the screen with what's going on in the video. Once you wake up in the morning, you're unhooked from all the wires. There's a couple pieces of paperwork to fill out, and you're let go. Our day staff then will read the sleep study, meaning score it. So they'll score the stages of sleep. There are different stages. They'll score any apnea events that you may have, any leg movements, anything out of the normal we want to document so the doctor can paint his picture or her picture of, the patient's symptoms and what might be going on. Once it's done by our day staff, the physician then will read the sleep study epic by epic, and look at everything that happened, create their report, and then the patient will come in and meet with the doctor, and they'll go over the results.
So some people, from the time they get home until they go to bed, they're eating and drinking and consuming whatever. Do you control their consumption of food, or do you let them do what they normally do?
That's a really good question. That's a great question. And I think it just kind of depends on what we're looking for. There are different types of sleep disorders. If we're talking about sleep apnea, I'm as a technologist, I would let them kind of do their normal routine to see what's going on. If we could treat it simply with cognitive behavioral therapy, we will do that. We want to treat the easiest possible way. So if we're seeing, and typically more than caffeine, more than food, it's cell phones and electronics. If we can fix having timeouts on electronics, and we can see that that's going to enhance a patient's sleep, will certainly go in the report. But yeah, we try to keep them as regular as possible.
Okay. So If the doctor orders a positive pressure machine or CPAP, what can I expect?
Oh, that's a good question. We work with a number of different durable medical equipment agencies, we're always reevaluating the need for patient experience. That's our number one goal. I think what you can expect from the patient perspective is that once you complete the CPAP titration, you will be called by a DME company to come out to your home and get you set up on a machine, answer any questions that you have, show you how it works, give you a contact in case you have any problems, and then we will follow up with you in the clinic, within usually 30 days or so, just to see how you're doing. Most of these companies can remotely check in too, to see how your CPAP machine is doing, if you're wearing it, if there's a leak in the mask, they can call you up and say, Mr. White, we saw that you haven't been wearing it the last 3 nights. What's the problem? And we found that just creates great success in patients' experience, to be able to answer those questions and to be able to be, to be connected to them that way. It's phenomenal. And then just ongoing assessment. We will be able to keep watch on you and answer any questions that you have through the whole process.
Can my primary care physician order that?
Absolutely. They can order any sleep testing. There's 2 options at Cleveland Clinic Mercy. You could have your primary care offer or order the sleep test. And then we would get that order. We would call you to get you scheduled. We also offer the ability. Sometimes, these family doctors get kind of busy and they would rather push it off to a specialist. So we have a specialist in-house that will do a comprehensive physical exam, talk with the patients, get an understanding of what's going on, and then order testing based on the need.
Interesting.
Yeah.
Okay.
Can you explain what it means to be accredited by the American Academy of Sleep and why this is an importance in selecting a sleep facility?
Yeah, absolutely. We just actually went through the accreditation process last year as I was coming in here. I've accredited labs in the past, and it's really just a badge of being able to say, we have all of our organization is elite. It's a badge of pride. The American Academy of Sleep Medicine provides an outline of what they expect of a facility, and we as a group make sure that we fit into that elite group. And what that looks like, Brad, is that our technologists are going through continuing education. They're constantly learning. We are constantly communicating on better ways to enhance the patient experience. So I think that's where you differ from accredited facilities to non-accredited facilities. It's our passion, and we want to be at the top. So that's why we get that accreditation. And it doesn't just stop at the technologists. Our physicians undergo it as well. All of our physicians involved do the continuing education and follow that.
Okay. Millions of Americans suffer from the inability to get a good night's sleep. And aside from sleep apnea, what are some other sleep disorders that could impact our listeners' sleep ability?
That's a great question. We've touched on a couple of them. Insomnia is actually the number 1 sleep disorder. That's the biggest. I think it affects the widest range of people, and that's the ability to fall asleep or the inability to fall asleep, and the ability to stay asleep. And we were talking, Paul asked the question about patients' consumption before bed. That's where we would look at, okay, what's causing the problems? What's causing this patient not to be able to fall asleep? or to, if they go to the restroom in the middle of the night, are they back on the cell phone, when they climb back in the bed? So those are easy fixes. We also see restless leg syndrome. You may have heard of that. And that is when a patient rhythmically kicks their legs during the night, and we monitor leg movements, so we'll be able to see that during the polysomnogram. Now, typically, those patients will present like someone that has sleep apnea in the clinic. They will be exhausted. Typically, they'll have excessive sleepiness, fatigue. And when I'm talking to them, I'll ask them, does it feel like you wake up in the morning, you feel like you ran a marathon race? Because typically they will. They'll feel cramping in their legs. They're just tired. Another one we test for is narcolepsy. Everybody remembers those students in school that just couldn't get it together, and maybe they were labeled as lazy kids. They were asleep at the desk, and that's why it's so important that we talk about this, because they may have had narcolepsy. They may have had an actual medical disorder that they're just excessively sleepy, and they're dealing with narcolepsy, and that's a neurological disorder. It's intermittent, it's uncontrollable, and people just fall asleep much quicker and reach deeper stages of sleep than normal.
Okay, Ben, last breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. St. Patrick's Day is just around the corner on Wednesday, March 17th, and you have to wear the green. The Half Off and Out By store in Louisville has built a huge green display: hats, wigs, necklaces, jewelry, beads, and much, much more. I know you're itching to celebrate just about anything since you've been constrained for so long. See us on Facebook at Half Off Hot Buy and also on our website at Half Off Hot Buy. So hurry over to the Half Off and Out By store in Louisville. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Yes, we are open. We are open. The Medicine Center Pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play: our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us this morning, and let's get back to the final segment of the show. Where are we at, Brad?
All right. Does Cleveland Clinic Mercy Hospital have sleep specialists to evaluate different types of disorders?
Yes, we do. We have Dr. Amir, and Dr. Amir is located at our Jackson Stat Care office. Dr. Amir runs a sleep clinic there 3 days per week, Monday, Tuesday, and Wednesday. He does do all of the clinic work there. He also reads sleep studies there, and does everything involved with sleep from our Jackson location.
So, new patients, is Dr. Amir taking new patients?
Yes, we are. Yes, we are actively, and we're able to quickly get patients on the schedule for new patient sleep appointments. Dr. Amir is also a pulmonologist, so we'll see pulmonary patients there as well.
So I guess I'm thinking, can we cure this thing? Can we cure, or do we have constant appointments with the doctor, or going forward, or evaluations, or what's the story?
Yeah, so we do evaluate patients, and obstructive sleep apnea doesn't really discriminate. I think when it became new, it was just obese males that suffered from obstructive sleep apnea, but that's not the case. The fact is that children also suffer from it as well. You take anatomically, you take a small airway and put two large glands in front of it, and you already have an obstruction. So everybody has different reasons for having obstructive sleep apnea. If you were to be put on treatment and weight loss is an option, your doctor would push you in the way, if you were looking to not wear CPAP and didn't like CPAP, maybe a way to get rid of that. And we do have patients every year that, change a lifestyle and get rid of their CPAP. We do an evaluation on them again, do another test, and find out that they've cured themselves of obstructive sleep apnea. There are different procedures and different treatment options as well. From oral appliances, we've seen the dental world getting into doing some oral appliance therapy. There's positional therapy that the doctors will talk about. Surgical procedures aren't really done very much anymore, just because CPAP is the gold standard and it works. And I'd like to attribute that to our communication skills, both with the patients and the companies that provide the equipment. The patient really has an open line of communication now, instead of not knowing what to do when there was a problem and just putting the CPAP mask in the closet. Now they can reach out for help.
We're running out of time here, so I'm going to rocket a few questions at you. Okay?
Sure, yeah.
All right. Why is healthy sleep important? What is sleep hygiene? How much sleep do we need? And how can we improve our sleep hygiene?
Yeah, absolutely. So sleep is important in different stages of our life. As we're children and as we're kids, we need more sleep because we're secreting human growth hormone. So that's what really helps our bodies grow like a plant. As we get age, we require less and less sleep. And sleep is important, just like nutrition and exercise. It's a big triangle. You can't have one without the other. It's vital for our physical health. Do you feel like running a mile if you've only slept an hour a night? Typically not. It's also vital for our mental health. You can't be prepared for a big exam if you don't rest. Sure. Our memory and focus is all based around sleep and our rest. Sleep hygiene it comes from a variety of practices or habits that are necessary. That's what we were talking about, what to eat or do before bed. It's important that we just stick to a nighttime routine that is the same. Don't exercise and run 3 miles and then jump into bed. You're going to be increased. Your heart rate's going to be up. Try to do the same thing. Read a book. Try to stay away from the electronics and the blue screens and TVs. Warm baths are good. Showers, a hot shower. Try not to stimulate your blood sugar by eating a bunch of things before bed.
Okay, Ben, we
Yeah.
got to get your phone number so they can call
Sure.
you, and then
Absolutely.
we got to close the show.
I could go on forever about this. This is really a passion for us. Sorry.
Sure.
So they can call me anytime or any of our staff at 330-489-1456. And that's to the Cleveland Clinic Mercy Sleep Lab.
Okay.
We'll answer any questions.
Okay, super. Thanks for having coming in
Thank
today.
you.
And Ben Benedetti, Clinical Manager of Sleep Center at Cleveland Clinic Mercy Hospital. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Cleveland Clinic Mercy Hospital and Studio Arts and Glass, and of course, our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC. Thank you again, Ben.
Hey, thank you so much, gentlemen.
Thank you for joining
Enjoyed
us
it.
for this
Have a great
edition
day.
of Health
Thank
Matters
you.
with the
Too.
Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember,